as the expert in the field, Dr. Sood, I would like you to elaborate on how these substances affect sex and sexuality, and how male and female sexuality differences also happen in those who are using substances.
As much as I talked about the sexual response cycle, but for this cycle to play out, you need a brain that is receptive and active. You need a nervous system which perceives touch, smell, sound as the inputs to get the brain activated. You need a vascular system which is pumping blood into the genital organs in a preferential fashion to bring about changes in the man, which involve more blood flow into the penis and leading to an erection. In a woman, they involve more blood flow to the genital area with more secretions from the cervix, from the vaginal lining, from the glands in the vagina, leading to lubrication, which would then facilitate intercourse. So once we understand the sexual cycle, and we also understand the anatomical parts required to successfully conclude that cycle, and we bring in intoxicants to tinker with our perception or our performance, it may seem that the intoxicant initially works on some phases of the sexual response cycle. So as you rightly brought out, that alcohol, cocaine, cannabis provoketh the desire. So somebody who is having a low desire may think that if I consume some of these things, it would enhance my desires. Actually, more often than not, the so-called enhancement that it brings about is more to do with easing anxiety, easing the guilt, and taking away the inhibitions which we may have acquired in our adolescent years or in our growing up years from our past sexual experiences. So in the short term, it is just a perception for the person involved that I am feeling good or I am feeling better. But when it comes to the actual body parts and their performance, all these intoxicants have a negative impact on the sexual cycle. So if your mind is not perceiving a sensation, if you are so drunk that you are incoherent, communication is suffering, alcohol makes the blood pressure fall, so there is less blood flow to the genital organs, so there is a poorer erection. So not for a moment can science recommend any of these intoxicating substances as sexually performance enhancing substances. Sadly speaking, consequent to whatever may be social perceptions or peer pressure, leads a person to experiment with these substances, and then some people unfortunately become addicts, and then it all spirals downwards, where relationships suffer, where a lot of distress happens, and that's where people like you who help such patients come out of their troubles play a very important role in fixing problems generated by intoxication and addictions.